We at LAPO are committed to poverty eradication. We equally believe that the battle against poverty requires the effort of everyone.
Good morning, viewers. This is Bridging the Gap, a program that comes to you from Lift Above Poverty Organization LAPO. My name is Patience Nauku Umwana. And on today's program, we are going to be discussing, or our focus is going to be on maternal mental health and child well-being. And I have with me today in the studio Dr. Ehigiator Adayonfo. Doctor, you are welcome to this program.
Thank you, and good morning, viewers.
Yes, we are going to be talking about maternal mental health and child well-being. And I want to say that the mental health of women is very, very important. It's very essential to her well-being, that of the baby, the family, and even the community at large. But unfortunately, we have several women, in fact, millions of women in Africa experiencing one form of mental health challenge or the other during pregnancy or after delivery. So on today's program, we are going to be looking at this. But before we go on, we are going to take the LAPO message. Let's go straight to our discussion. I'd like you to tell us what we actually mean by maternal mental health.
All right, thank you. Maternal mental health describes a state of well-being where a woman who is pregnant or a woman who is within 1 year of having given birth, which classically will imply a woman who is between the ages of 15 and 44 years, is able to cope with the normal stresses of life. And she is able to realize her abilities, and consequently she can work productively and fruitfully, and therefore able to make a contribution to her society or community. So in a nutshell, if a woman is able to meet these criteria, that is a woman who is pregnant or a woman who is within 1 year of having delivered or having given birth, we can say such a woman is enjoying maternal mental health.
Okay, what is the statistics now looking at mental health illnesses in Nigeria generally?
Yeah, the prevalence of mental illnesses amongst women who are pregnant is such that about 15% of women who are pregnant have a mental health problem. So out of 100 women who are pregnant, as much as 15%, indeed in some studies, as much as 20% of them have a recognizable mental health illness. And then for women who have given birth, who are within 1 year of having given birth, the statistics is such that as much as 33%, and in some studies, as much as 40% of them have a recognizable mental health illness. What this means is that out of 100 women who have given birth, whose babies are yet to celebrate 1 year, or who are within 1 year, because women can give birth and they don't have the baby with them. Out of 100 of them, as much as 40 of them have a mental health challenge. So that is the statistics as it stands today. And if you look at these figures, these are very high figures.
These figures you're talking about, are we situating Nigeria now?
Yeah, we are looking at Nigeria.
Okay.
I looked at Nigeria. Out of every woman that gives birth, or out of every woman that is pregnant, as much as 15 of them out of 100 have a mental health challenge. And when they are giving birth, the prevalence for mental health problem rises. And it can be as high as 40% of such women who have given birth having one mental health illness or the other. The only saving grace may be that majority of the mental health illnesses that these women suffer is depression and anxiety.
Okay.
And so a great majority of times our people they are able to cope relatively with them at home. But rarely, if you were to subject women who are pregnant to screening for mental health illnesses, the figures are such that out of 100 women, 15% of them have a mental health challenge. And when they have given birth and they are within 1 year of having given birth, as much as 40% of them have a mental health illness.
That's quite high. Okay, let's look at, I know you've mentioned anxiety and depression. Let's, in details now, let's talk about some of these mental health challenges that women who have given birth or during pregnancy, what they experience, some of these mental health challenges that they experience.
Yeah, there are, during pregnancy, a woman may experience depression. A woman may experience, obsessive compulsive disorder. A woman may even experience generalized anxiety disorder. And some women may also experience a psychotic illness called schizophrenia. And then some may experience bipolar affective disorder. Well, when they have given birth, some women will experience a mental health illness for the first time in their life when they have given birth. And there are 3 classical psychiatric illnesses that women may experience for the first time in their life after giving birth. These illnesses are also called postpartum illnesses, and they include what they call postpartum blues, number 2 postpartum depression, and then number 3 puerperal psychosis or postpartum psychosis. Postpartum simply means after giving birth. Post, after, partum, has given birth. So invariably, the kind of mental illnesses that you can observe in the general population, are also very, very possible in pregnant women and in women who have given birth. Now, the only one, just for the sake of academic activity, when a woman experiences mental health challenge for the first time in her life after delivery, that is what we call postpartum psychiatric illness. Which means if a woman had depression when she was a teenager, eventually gets married, gives birth and have depression again, we will not call it postpartum depression. Instead, we will not call it recurrent depression. But by and large, I think these are academic discussions. What matters here for our general public is to note that all the mental health problems that other people experience can also be experienced during pregnancy and indeed within 1 year of delivery. The only thing is that the potential to have a mental health illness for a woman becomes very increased during pregnancy. The potential to have a mental health illness becomes very high within 1 year of having given birth. I hope I'm clear. Invariably, pregnancy and 1 year after delivery, they are challenging times for women. And because more or less mental health illnesses are linked to stresses, difficulties, it is not surprising that the highest time for a woman to have a very high prevalence or possibility of developing mental illness is when they are pregnant or when they are within 1 year of having given birth.
We've been talking about maternal mental health and child well-being with Dr. Adayonfo Ehigiator, and we are going to take our break now. We are going to bring you the Faces of LAPO. The Faces of LAPO is a segment in this program where you get to meet clients of LAPO Microfinance Bank sharing their experiences with the bank. Please stay with us.
Mrs. Chinyere Gladys Okoro is a distributor of stockfish in Gwagwalada Main Market. She has been in the business for so many years now and has achieved a lot through the business. She has trained many persons and also have many in her payroll.
My name is Mrs. Chinyere Chidebere. I'm living in Abuja here in Gwagwalada Area Council. I'm doing stockfish business. I'm the dealer in Gwagwalada Area Council. So I started the business since 2004. When I started the business, I just had small capital. That was 150,000 naira for the business. In year 2013, I joined LAPO, and the reason why I joined them, I wanted to increase my business. Because a friend of mine told me about LAPO that time that I should come, they will assist me. They really assisted me. I started with them with 500,000. As I'm talking to you, at least I'm collecting 3 million, 3 point something, the last one that I collected now. And their money had been helping me in many things. Then when I started, the things start moving. Before you know it, I start using from 500,000 to 1 million, from 1 million to 2, 3, 4. At least now the thing that I'm buying now, at least I'm buying with 7 million or 8 million when I go to market now. At least I have about 4 workers, even some people that will learn from me here, they will open their own shops.
With high expectations, Mrs. Chinyere Gladys Okoro speaks about her future plans and what she hopes to do.
I want to increase my business. I want my business to at least, people know me already, but I want to have branches in Abuja here. I want to have branches because many people, they are coming to buy from me, but I want to have branches like Zuba, Madala Market, all these Gariki Market. Then I want to have the branches. Then if I thought that I have any means, then I can go to outside and bring it direct.
She also has these words of advice for women and expresses her deep gratitude to God Almighty, appreciates LAPO for empowering women, and prays for the sustainability for LAPO.
LAPO, they have been very, very good. In my shop, they have made me whatever I am today. I really appreciate them. Understand? For me to be collecting their money, using it to build houses, do many things that is helping me. I have achieved a lot from LAPO. I really appreciate them. So I thank them very much for everything they have been doing to me and my family. God will bless them for me. I'm advising the women, more especially all the young ones, that this life is not a bed of roses. You know, you have challenges, but in life, anything you do, you have to put interest. When you have interest in everything that you do, you will see yourself growing big. I started with small capital, but today the business have grown big because I have the zeal that I know what I want. I know what I want, that one day that I'm going to, this business is going to grow big. So I'm there advising women that have the opportunity. If you have small capital, just know how you spend your money. It's not everything that you see you buy. Some women, they will just have money, they will use it and buy the thing that they will wear. Then people will just see them, they are wearing expensive something. No, it's not done in that way. When you started doing like that, your business will go down.
Welcome back. Before our break, a doctor was trying to explain why, or some of the reasons why a woman who is pregnant could, fall into depression or have mental health illnesses or challenges. I think we are going to continue with that, doctor.
Okay, thank you very much. Now, genetic factors are reasons why women can have a mental health problem in pregnancy or after delivery. If the woman's mother experienced it, there's a likelihood that she will experience it. So that's genetic factor. Then hormonal factors. During pregnancy, the woman's body changes. And then some of these hormones or hormonal changes during pregnancy or immediately after delivery, they affect mood, they affect behavior. And so these changes are the reasons why some people have, these changes are known to be, cause some mental health problems or mental health symptoms, and where excessive will lead to outright mental health problem. And then, personality traits. Women who all along have been an introvert, they are secretive, they have a problem trusting people, they are likely to develop mental health problem in pregnancy or after giving birth. And then there are a lot of social factors. For example, teenage pregnancy. Such a person is likely to develop depression when a teenager gets pregnant. Then people who get pregnant from rape. So if a person gets pregnant because she was raped, such a person is likely to develop a mental health problem during pregnancy and after. Single people who are not married, who just get pregnant from their partner, and unfortunately again the partner is not supportive. It's a recipe for mental health illness in the course of pregnancy. Then of course, poverty. Husbands that use drugs, alcohol. Studies have shown that their women or their wives are likely to have depression in the course of pregnancy. Then women who are victims of gender violence, they are constantly being beaten up. They are likely to have depression. Women whose husbands are illiterate, women whose husbands don't have a job. Research has shown that these are the women who are likely to have mental problems in the course of pregnancy. And of course, women who have had mental problems before pregnancy, it's expected that if you have a woman booking for antenatal and she says, 15 years earlier she had a mental problem, ordinarily that's a woman you need to follow up, because such a woman is very much likely to develop mental problem in the course of pregnancy and thereafter.
So what's way forward now?
Well, the way forward is simple. let all hands be on deck. Let family play their role, especially with regards to rearing of children. There's a way to rear children so that the ladies will respect men too will respect ladies. The churches have a role to play. These are places where women go to. The mosque, the same thing. They have a role to play. Empowerment of women, very fundamental. Women should have autonomy. Lack of autonomy is a risk factor why women have a mental health problem. If a woman is in charge of her life, if a woman is in control of, if a woman is able to work, many women don't work because their husband say don't work. Why we do not have depression? Meanwhile, work is not about money only. It's also about realizing, like I defined mental health earlier, realizing one's ability. If you don't realize that ability, your mental health is already questionable. So these are the issues. So then again, government has a role to play. Let them make the primary health care functional. So that if it's really functional, then people who have risk factor for mental illness, it will pick up very early, and they will be treated. They will give birth to healthy babies, physically and mentally, and very soon Nigeria will not have good people. Because if you are giving birth to children who are emotionally disturbed, it means that you are giving birth to, in quotes, if you like, substandard people. You see? But if you are giving birth to the right children, it means that after some years, the people who were not properly giving birth to, they will leave the stage. The time will come, all the people that will remain, people were properly giving birth to. And then Nigeria will now begin to move forward because you now have the right people who were properly giving birth to in place or in position. But in as much as we are in this situation where people don't go for antenatal. In fact, you know, even suicide is a leading cause of why women die. Within 1 year of delivery, as much as 10% of women. 10 out of every 100. Mortality in the puerperium, or what they call maternal mortality, suicide is a major cause. And the suicide again because of mental illnesses. So these are very serious issues. That's why when some of us are asked to come and talk about these issues, we are excited about it. Government may not be listening. Government is the problem. I know people, individuals, family, they listen and they try to make adjustments because the ignorance continues to be a very big problem. Yeah. Our literacy is poor. Again, what they call mental health literacy is even very, very poor. People who are supposed to be highly educated, I have seen some beating their wives. So when a man beats his wife, a highly educated person, beats his wife in the presence of his children, then the son is also there. What is he telling the son? He's telling the son that, there's nothing wrong with beating the woman.
Thank you so much, Doctor.
Thank you
for coming on the program. We've been talking about maternal mental health challenges and child well-being. We've been talking about this with Dr. Ehigiator Adayonfo. He's a consultant from the University of Benin Teaching Hospital. And one of the things that Doctor has said that I really want to point out is that for us to tackle the issue of maternal mental health challenges, we have to have a functional primary health care system, and also there is support. Women, mothers, before giving birth and after delivery, they need support. They need family support from family members, from husbands, partners, from everybody, from the community generally, to be able to, carry on even after delivering the first 1 year of the postnatal period. A woman needs that support, emotional support. So we encourage our women and even partners and husbands or family members, when you notice that your loved one who is pregnant is passing through some of these the signs or the symptoms that Dr. Adayonfo has enumerated, you quickly take such a person to the hospital for attention. That's where we'll draw the curtain on the program for today. And if you'd like to talk to Dr. Ehigiator, you can do that. You can call the numbers on the screen, or you can visit any of our offices or our head office at number 18 Downsing Road, Benin City. We like you to watch out for this program again next Saturday, same time and same station. See you, we come your way again. Have a lovely weekend.